My name is Gabriela Berry. I'm a student practical nurse at Williston State College. And today my group and I are going to do the health assessment of the eyes, the ear, musculoskeletal, and neurological systems. And for the purpose of this video, I'm going to be the nurse.
Hi, my name is Sam Farr. I'm a student nurse at Williston State College, and for the purpose of this video, I'll be the patient.
Hi, my name is Mercy Williams, and today I'm going to be the videographer for this video.
Okay. So I already checked my providers, the healthcare provider's order. I know the patient charts, and I already reviewed his vital signs. So I'm just going to do hand hygiene. I will proceed to enter the patient's room and introduce myself and so on. Provide privacy. Good morning, Sam. My
Hi.
name is Gabriela Berry. I'm a student practical nurse at Williston State College, and today I'm going to be your nurse, okay? Will you please confirm your name and date of birth?
Sam Farr, February 11, 2003.
Okay, and that matches my providers. Okay, so what brings you here today?
Just a headache.
Okay, so you have a headache? And when did the headache start?
This headache started about like a week ago.
Okay. And will you please describe what type of pain are you experiencing? Is it-
One-sided
Okay,
headache, like migraine.
okay. Is it like a sharp pain or?
Yeah, this is sharp pain.
Okay, and what make your pain worse?
When I stand up,
Okay, what make it better?
when I lay down.
Does it radiates?
No, it's just one.
Okay, have you taken any medication or are you doing anything to treat the pain?
Just Tylenol.
Okay. Have you seen a doctor for the pain?
No.
Okay. On a scale from 0 to 10, with 0 being no pain and 10 being the worst pain you ever had, where's your pain at?
It's a 5.
Okay. And how is the pain affecting your activities of daily living?
I usually work out, but since I've been feeling this pain, I've just been relaxing.
Okay. So I'm going to do a physical assessment of you, and it's going to take about maybe 30 or 35 minutes. Is that okay?
Yeah.
Okay. So I am going to start with the assessment of the ear. I'm gonna ask you a couple questions. Okay. So the first one, have you had surgery in your ears or any injuries? Do you have difficulties communicating with others?
No.
Background noise affects your ability to hear?
No.
Okay. Hearing loss?
No.
Okay. Have you had your hearing tested?
Yeah.
Okay. Do you use hearing aids?
No.
What about cochlear implant?
Mm-mm.
Okay. Have you experienced pain in your ear?
Mm-mm.
Any discharge?
No.
Okay. What about ringing or buzzing in your ears?
No.
Okay. Have you experienced dizziness or vertigo? What about loss of balance?
Mm-mm.
Okay, now I'm just going to inspect your ears, and I'm going to look for alignment, symmetry, skin color, depressions, and deformities as well, and the size. As I look into your ears, I can see the color is the same as the rest of the skin. They are equal in size and shape bilaterally. Normal size between 4 and 10 centimeters. I don't see any deformities. There is no inflammation, nodules, or drainage. That's for both ears. So I'm just going to palpate your ears now. Is that okay?
Yeah.
Okay. There is no tenderness, and the ears have a firm consistency. And I'm just going to use the otoscope, and I'm gonna check the tympanic membrane. Okay, so I can see the bony landmarks. The color is normal. No redness. Let me look for example. Okay, so it looks shiny. No redness or drainage. Those are normal findings. I'm going to assess your hearing, okay?
Okay.
And for that, I am going to assess also the acoustic nerve, okay? So I'm just going to use the whisper voice test. I'm gonna need you to hold the chair here. So I need you to be in the sitting position,
Okay.
and I'm going to stand behind you around 2 feet apart, okay?
Okay.
I'm going to whisper some letters randomly, and I'm gonna ask you to cover one of your ears. I need you to identify the letters or the numbers that I'm going to say, okay? Okay, so now I need you to cover one of your ears. Okay. A, B, C, D, E. Repeat it.
A, B, C, D, E.
Okay. Now the other ear. Okay. So I'm gonna do the same thing, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Okay. So that's great. You were able to identify the letters and the numbers in both ears. So those are normal findings. So everything is good for your ear, okay? And nothing is wrong with your acoustic nerve. Okay. So now I'm going to move on to the assessment of the eye. So I'm going to ask you some questions as well, okay? Okay. Have you had any eye problems or eye diseases? What about cataract, glaucoma? Okay. Did you have eye surgery? Okay. Did you verbalize it? Okay. Do you have a history of any congenital diseases such as diabetes,
No.
macular degeneration,
No.
glaucoma?
No.
How often do you get your eyes examined?
Not often.
Okay, okay. And when was your last examination?
Probably like a couple years ago.
Okay.
Yeah.
How is your vision?
I'll say it's pretty good.
Okay. Do you have difficulty reading or seeing objects at a distance?
No.
Do you wear glasses?
No.
Contact lenses?
No.
Okay. Do you have any drainage in your eyes? What
No.
about itchiness? Drain? Okay. Crusty eyes?
No.
Okay. Do your eyes feel dry or irritated?
No.
Okay. Do you have excessive tearing?
No.
Have you experienced double vision
No.
and not itchiness?
No issue.
Okay. Are you feeling any pain in your eyes right now?
No.
Okay, so everything's fine. So now I'm just going to inspect your eyes. I'm gonna look at them, and I'm going to palpate it as well. Okay. So as I'm looking at your eyes, I can see that there is no protrusion. They're symmetrical. The eyelashes are equally distributed. I don't see any drainage, any crustiness. The upper and lower eyelid, they can close completely. There is no drainage, no redness. There is no dropping of the eyelids. And I'm just going to, okay. Okay. So the pupils are equal size. Okay, the conjunctiva is pink and moist, and the iris has a normal color. Okay. The lacrimal ducts, they are not swollen, and the palpebral fissures, they are equal bilaterally. Okay. So I don't see any involuntary movements of the eyes, and all those are normal findings. Okay. So now I'm just going to check visual field for peripheral vision, and this test is going to assess the cranial nerve 3, 4, and 6. Okay, so those are the cranial nerves responsible for eye motility. So I'm gonna need you to cover one of your eyes, and I'm gonna cover my left eye, right? So I need you to look at my uncovered eye, and I'm gonna need you to say now when you see my fingers, okay? Okay, and also I'm gonna need you to tell me how many fingers you can see. Okay. Sorry. Say now when you see the fingers and how many.
No. No.
Okay.
No.
Okay, perfect. Now let's do that with the opposite eye, okay? Okay. So here I go. You say a little louder?
Oh,
so-
yeah. Now.
Okay,
Now.
perfect.
Now. Now.
Okay, so that's good. So your peripheral vision corresponds with my visual field, and those are normal findings, okay? So now I'm going to explain eye movement for the 6 cardinal field of gaze, and this is also going to assess the cranial nerves responsible for motility, cranial nerves 3, 4, and 6, okay? And for this assessment, I need you to follow my fingers, okay? Without moving your head, just, okay? Okay. And I see that your eyes can follow my finger with no issues, and those are normal findings. So there is nothing wrong with those cranial nerves, okay? So now I'm just going to assess for pupil size and consensual response. So I'm just going to use my pen light. Okay. Okay, so I'm just going to, I see that your pupils, they constrict at the same time to respond to light, and they have a consensual response, okay? So they dilate at the same time. And those are normal findings. Now just let me inspect your eye for accommodation, okay? So, and for this test, I'm just going to try to touch the nose with my index finger, and I just need you to look at it for 30 seconds, okay? I need you to follow my finger, okay? Okay. Let's pretend we did that for 30 seconds. And I see that both eyes, they constrict at the same time to look at the nearby object, okay? So now I'm going to check your visual acuity. And this is going to assess visual acuity for distant vision and cranial nerve 2 as well. So I need you to cover your left eye. And I need you to read the chart. I need you to be at 20 feet away. And I'm gonna ask you to read each line. Okay. So start reading the lines now.
Okay, E. Okay. So start from where?
Okay, so you're going to start from the top.
Mhm.
You wanna go from left to right.
Okay.
Okay.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, F, O, T, E, C, L, E, F, O, D, F, C, T.
Okay. Continue.
The right side? Okay.
Okay. Now do it with the opposite eye. Okay.
Okay, E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, F, or D, E, F, P, O, T, E, C, L, E, F, O, B, F, C, T.
Okay, then you can proceed. So you were able to read this line, all the letters. You did a very good job. So that means that your vision is 20/20. It means that you can see what a person with normal vision can see at 20 feet apart. Okay, so those are very good findings.
Okay.
Okay, so now let's move on to a different assessment. So I go back again. Okay, now we're done with that. We're just going to assess your musculoskeletal system. And I'm going to start with a couple questions, okay? Okay. Do you have a family history of any diseases Do you use any medication? Will you verbalize it?
Oh, no,
So- Okay. Any changes in your ability to move around?
no,
Do you feel any numbness, tingling in any of your muscles?
no,
Any swollenness?
no,
Okay. Okay. Have you experienced any changes in your skin color?
no,
Okay. Have you felt that your skin temperature to be cooler or hotter than usual?
no,
Okay. Have you had any accidents or injuries that required surgery to correct muscles or repair joints? Any alignment issues?
no,
Okay. Does anyone in your family have curvature in the spine?
no,
Okay. What about history of rheumatoid arthritis, osteoarthritis?
no,
Okay. Is there any family history of musculoskeletal problems? Okay.
no,
Okay. Do you consume alcohol?
no,
Okay. Do you practice exercise or,
yeah,
okay, any health promotion practices? Just exercise?
just exercise.
Okay. Okay. Do you consume calcium?
Yeah,
Okay. Have you got osteoporosis screening?
no,
Okay. So now I'm just going to inspect your skeleton and extremities for alignment and symmetry. Okay? Yeah. So I just need to stand up. So I'm just inspecting for size. I'm going to look for any disabilities, debilitation, any abnormalities. Okay. You please move here. I'm going to start with inspecting your gait, okay? So I need you to walk away from me
okay,
and then come and then back toward me.
okay, so what?
Okay. Okay. Perfect. Okay. So I see that there is no limping. The gait length is about 1.5 meters, which is normal. Left arm swing forward, and the right legs they swing forward as you move. So I don't see any issues with balance, and your gait is just normal. Okay. It's okay. I'm just going to assess your posture and vertebral column. And I need you to rotate your head to the right, rotate it, now to the left. Now tip your head to the right, and then to the left. Tip it, yeah. Now flex your neck. Okay, yeah, try to touch your chest, and now extend your neck and look up. Perfect, okay. I will position myself behind you, and I need you to bend forward at the waist, okay? Perfect. I see that your spinal cord, I can see the spinal cord. I'm going to palpate it. Can I palpate it?
Yeah.
Okay. So I'm just going to pretend that he's not wearing a shirt. I'm going to start at the cervical spine, moving toward the sacrum. Okay? So now I need you to bend backwards. Backward and forward from the waist.
Backward.
Okay, okay. I see that your shoulders are even, there are no slope forward. I see symmetry between the motion, the range of motion of the neck, and the movements are fluid. Are you experiencing pain?
No.
So there is no pain. And when standing on your feet are shoulder width apart. Okay, so now I'm just going to inspect and palpate your upper extremities and both sides. And just let me know if you feel any pain, okay? So I'm just going to do palpation. So upper arms are straight. The elbows are just bent slightly. Okay. Okay, the palms are facing the upper legs. I didn't feel any tenderness. You didn't report pain, no soreness, no depressions, no protrusions. And I don't see any missing limbs or missing fingers, okay? So now I'm just going to assess for the range of motion of your muscle strength, okay? So I'm just gonna ask you to perform a series of movements. You're gonna do those movements independently and you're gonna do it with resistance, okay? Let's start with your shoulder. I need you to flex your shoulders. Okay? Okay? Okay. Now, flex against resistance. Okay. Okay, just try to do it against resistance. Okay, perfect. Up, down. Okay. So, now I need you to extend the shoulders. So, I'm gonna go back. Okay, now let's do that against resistance. Okay, so now, okay, against resistance. Okay, now I'm gonna need you to use, I'm gonna need you to abduct your shoulder, abduction of the shoulders. Okay, and can you do that with the other one too? So, okay. Okay, you can bring it down, and now we're gonna go against resistance. Okay, try to do that. Okay, then that with the other side. Okay, now I need you to adopt your shoulders, so you're gonna come like that. Okay, now let's do the same again, resistance, come. Okay, now with the opposite side. Okay, there you go. Now let's do that against resistance. Okay, perfect. Now let's do internal rotation. So let's just gonna internal rotation. Now do it against resistance. Okay, let's do the opposite side. Okay, there you go. Now let's do that against resistance. Perfect. Now I need you to do the range of, I'm going to assess the range of motion of your elbow. So, but let's do internal rotation now. Internal rotation, you're gonna come, okay, like that. Okay, just now against resistance. Okay, now with the opposite. Okay, okay, so perfect. Okay, so okay, now let's flex your elbows, okay? You know how to do that?
Yeah.
Okay, so I need you to flex your elbow. Okay, now I need you to do it with resistance.
Okay.
Now let's do it with the opposite. Okay. Now against resistance. Okay, perfect. Now let's extend the elbow. Yep. Now against resistance. Okay. Let's do that with the opposite. Extend it. Against resistance. Okay. Now let's do pronation of the shoulders. Okay, you know how to do that? So let's do pronation. So pronation is with your hands facing down. Okay. So I need you to do that with one first. Okay. Now let's do that against resistance. Now let's do it with the other one. Okay. Again, testing the elbow again. Okay. Okay. Now let's do supination, like. Okay. So now try to do it against resistance. Okay. Now do the same thing with people. Supination. Perfect. Now against resistance. Okay. I need you to flex your wrist. Okay. Now let's do that against resistance. Okay. Perfect. Now let's do it with resistance. Perfect. Okay. So I need you to extend your wrist. Okay. Okay, now against resistance. Now the other one. Extend it. And then resistance. Okay. And let's do the radial deviation of the wrist. So I need you to go radial deviation, like that. And you go like that. And now against resistance. Okay. now we're gonna do the ulnar deviation, okay? You're gonna go, try to move your hands like that. Okay. So now let's do it with resistance. Okay, now let's do finger flexion. Okay. Now I need you to do it against resistance. Put your hands just like that. Do it against resistance. Okay, perfect. So now I see that all the motions are symmetrical on the left and right sides, and the fingers, they can move and flex completely. You didn't report any pain, any tingling. There's no numbness. And on a scale from 0 to 5, I will say that your strength is 5. So, and that is very good. Those are normal findings. Now I'm just going to inspect and palpate your lower extremities. And I need you to communicate if you're feeling any pain, okay? So I'm just, okay. So no pain, no depression, no swallowing, no pain, right? Okay. So I don't see any abnormalities with the size of the extremities. The patient is standing, and I see that both lower extremities are equal bilaterally. There is no forward flexing at the hip, and the upper leg as straight. The knees are bent slightly. Your ankles are perpendicular. And I see that your feet are straight forward and in alignment with your knees. Okay, and there is a slight arch on the medial aspect of your feet, which is normal. And okay, I am going to assess for the range of motion, okay? And the strength of your lower extremities. So let's start with your hips, okay? So I need you to flex your hips. I need you to flex. Okay, now the other side. Okay, I need you to extend your hips. Like extend it. Okay, now let's do that on the other side. Again, resistance. Okay, I need you to abduct your hip. Abduction, the weight. Perfect. Okay, now against resistance. This is for support, okay? So let's do that with the other side. Try to lift it. Okay, now against resistance. Now we're going to abduct, you side into the midline, okay? Okay, now with resistance. Okay, so let's do that with the other one. So, adduction, perfect. Now I need you to repeat the movement against resistance. Okay, now I'm going to assess for strength and range of motion of your knee. So I need you to flex your knees, like this. Okay, now against resistance. Now the other one, against resistance now. Okay, I need you to extend your knees now.
Extend my knee.
Yeah, okay. Against resistance, the other side now, extend it. Now let's do the same movement against resistance. Okay, so I'm going to assess your ankles. So sit down, please. Let's do dorsiflexion, okay? No, do dorsiflexion, okay. So I need you to do dorsiflexion. Okay, so.
Do I have to take up the shoes
You want to do it? Okay, so let's just do dorsiflexion. Okay, now against resistance. Now the other one. Okay, against resistance. Okay, let's do plantar flexion. Okay. Okay, against resistance. Okay, let's do that with the other one. Plantar flexion, and now with resistance. Okay, now foot supine. Okay. Forgot that. Okay, let's just do foot inversion. Okay, against resistance. Now the opposite side. Okay, and against resistance. Okay. So the movement of your joints are symmetric when compared to the other side. The motion is fluid. I don't see any restriction of movement. You didn't experience any pain, right?
No.
Okay, and they also have a strength of 5, and the range of motion was, they were all fluent, and like I said, you didn't see any pain. So now I'm going to assess your neurological system, okay? And I'm going to ask you a couple questions for that. So I remove my gloves, do hands hygiene. Okay, so we're just going to continue with the questions. Okay, let's go. Have you noticed any changes in your ability to move around?
No.
Okay. Do you have any chronic illnesses or conditions?
No.
Okay. Have you have any injury to the head, the spinal cord?
No.
Okay. Any surgeries of the brain?
No.
Okay. What about surgery of the spinal cord?
No.
What about any nerve damage?
No.
Any history of a stroke or seizures?
No.
Okay. What about any history of that in your family?
No.
Okay. Do you use any illicit drugs?
No.
Okay. Do you use a helmet if you are biking?
Yeah.
When you use your bike?
Yeah.
Okay. And how many hours do you sleep at night?
7, 8.
Perfect. Okay. And how do you deal with the stress?
Driving.
You drive?
Yeah.
Okay. Have
Going
you?
for a drive.
Okay. Have you experienced loss of sensation?
Loss of sensation? No.
Okay. Okay. Have you ever had any difficulty speaking?
No.
Okay, perfect. So I know that you are oriented because we have been talking for a while. You are conscious. You are able to identify yourself. You know where you are and you know why you are here, okay? So I don't see any issues with speech articulation, and you are able to sustain verbal communication. Those are good findings. So I'm going to assess your trigeminal and your facial nerves, okay? So I'm going to ask you to bite down. Okay. I'm going to palpate for contraction of the temporal masses there. Okay. I need you to smile, frown, puff your cheeks. Now raise your eyebrows. Okay. Close your eyes. Tight, tight. So I'm gonna try to open it. Tight. Okay. Say yes every time you feel touched, okay?
Okay.
Say yes every time you feel touched. So go yes.
Yeah.
So I'm going to expand the glossopharyngeal and vagus nerve, and for that I am going to check for your uvula. So let's pretend. I pretend that it's a gag reflex. Okay. So now try to swallow saliva. Okay. Stick your tongue out. Okay. I need you to say the words dynamite,
Dynamite.
tight,
Tight.
and light.
Light.
Okay, perfect. So now I'm just going to inspect your cranial nerve 11 for a spinal accessory nerve. So I'm just gonna need you to turn your head to each side. Turn your head to each side.
Light.
Yeah. Okay, the other side too. So now I'm just going to need you to repeat the same movement, but you are going to do that while I provide resistance. Okay?
Yeah.
Okay. So, okay, now with the other side, try to move it. Okay. So I need you to elevate your shoulders against resistance. Elevate them. Perfect. Okay. So you are able to elevate your shoulders against resistance, and you have the same amount of strength on both sides, and you can move your head independently and with resistance, and it happened in both sides. So, and all those are normal findings, so there is no issues with that. And you were also able to do all the movement that I requested. Okay. Now I'm going to assess for your cerebellar function, okay? Okay, I need you to walk at least 10 feet away from me. Okay, I need you to walk 10 feet away from me. Okay, now I need you to come back. Okay, so now I am going to need you to walk on your toes. Walk on your toes, yeah. Now, when you come back, I need you to walk on your heels, okay? Okay, perfect. Good job. So now I'm going to need you to walk away from me. Like I need you to alternate between walking with your heels and use the same that you did before, but a combination of both movements, if that makes sense.
Yeah.
So I need you to do that now.
Heels and toes.
Like heel, toe, okay. And now, back, come toward me now. Heel to toe, heel to toe, heel to toe. Perfect. Okay. Okay. Now, let's do the Romberg test. So I need you to stand with your feet together. Okay. And look straight ahead for 30 seconds with no support. I'm going to put one hand in front of you and another hand in the back. And I need you to close your eyes. Okay, and I need you to keep this position for at least 20 seconds. Okay. So this Romberg test is negative because you are able to maintain position without losing balance, okay? Okay, can you open your eyes? And you didn't open your eyes during the process of the test. So now I'm just going to inspect coordination. I need you to touch each finger quickly, yeah,
Each finger.
with your other hand, yeah. Yeah, just can do that quickly. And now with the other hand. Okay, perfect. I am going to need you to place your right heel on your left knee.
My right
Like,
heel.
okay, so I'm gonna need. Okay, I'm just going to need you to place your heel on your knees, and I'm just going to need you to run it down slowly. You can lay down or you can do it standing, whatever is more comfortable for you, okay?
My hand.
No, your heel,
My heels.
exactly.
On my knees.
So on your knee, you can use some support if that helps you. And I need you to come down slowly. Yeah. Okay, perfect. Okay. Now I need you to repeat the same movement with the opposite leg. Okay. And now, okay. So I need you to do the same thing with your eyes closed. You can use that chair as support so we prevent from any injuries from happening. So, okay, let's do that again. Over here, okay, your knees, okay, come down. Okay, perfect, Sam. And I see that there is no issues with the movement and they are smooth and they are coordinated. So I'm just going to assess for sensory function. You can take a seat, sit down. And I'm going to assess graphesthesia. And for that, I need you to close your eyes. And I'm going to write a letter in your hand and I'm gonna need you to identify it. Okay? So close your eyes, I need your hand. So I'm going to write a letter. Do you have any questions about the assessment?
No.
Okay, so I'm just going to write the letter. And I need you to tell me what letter was that?
O. Or
Okay. What was that?
that's C. C. O.
Okay, perfect. So let's do that with the opposite hand. Okay. And I'm going to assess for stereognosis. And for that, I'm going to place an object and I need you to identify it, okay? So I'm going to pretend that this is like a piece of stick, okay? Okay, I need you to identify that.
Tongue blade.
Okay, I'm gonna put another one. Now with the opposite hand. And what is that?
That's the pen.
A pen. So he was able to identify both, which is great, okay? So you were able to identify the letter that I wrote, and you were able to identify the objects. Those are normal findings, okay? You can open your eyes. Okay, now I'm just going to, assess your olfactory nerve, okay? And I have two different smells here, and I'm just going to, I need you to identify them, okay? So these are infused with the smell, and I need you to identify that. Please close your eyes, okay? What is that? Can you
That's
say anything?
Is that the Hampton thing?
Coffee and then mint. What is that?
Coffee.
What is this?
Mint.
Perfect, you were able to identify the smells, and I can see that all the findings for this assessment were normal. And I'm just gonna ask if you have any concerns, any questions?
No.
Okay, so you did great, and the assessment did very well. And the provider will be here, the healthcare provider will be here in 5 minutes, and I'm just going to come back in 15 minutes to check for you, okay?
Okay.
Any concerns or questions?
No.
Okay, so I'm just going to do hand hygiene. And Sam, would you like me to leave the door closed or open?
Can you leave the door open?
Okay. Okay, thank you, Sam, have a great day.
You too.